Here we go. Welcome. Welcome to HIM115, Health, Medical Records, and the Law. This is totally one of my favorite subjects in healthcare law. So I absolutely love it. And I'm going to be giving you extra stuff. And I am here for you. And this is really important that I want you to remember that just because, except for every Tuesday at 11:30, just because you can't see me, I'm still here for you. I promise I will answer your emails within 24 hours. I am in the course 7 days a week. Okay. So whatever you need, I'm here. So don't feel alone. Actually, I just heard this slogan. It said, do it for yourself, but not by yourself. And that's what we're all about here. Okay. So I love it when students ask questions. It helps me feel needed and wanted. Okay, let's get into it. Why in heaven's name do you need to learn this? Well, my favorite response to this is because CCTC does not have a bail bonds fund. So for alumni or students, actually. So you go out to work and you start breaking federal and state laws, we can't bail you out. So instead, we're going to just try and keep you out of jail and prison. What do you think? Good idea?
Yeah.
Yes. Healthcare is one of the most regulated industries. And I am thankful for that, not only because I find the law fascinating, but because healthcare, we are literally in life and death opportunity with our patients. We, by doing our jobs correctly, help our patients end pain and suffering and help them live good, productive lives. And it's all because the entire healthcare team, okay, it's not just doctors and even doctors and nurses. It's us in the medical records department, health information management. As a matter of fact, we have some of the strongest laws are with regard to what we do, which is collect, protect, and analyze healthcare data from every single patient we treat. We enable electronic health records, EHR, to work and provide information to physicians so they can make better, more accurate diagnoses, which is the only way to get an effective treatment plan. Okay, so you may look at us in the health information management department, in our offices, behind our computers, and you may say, well, we don't touch patients, and we don't touch patients. But we are still a critical part of the healthcare team because without us, physicians are in the dark about the patient. Now, just imagine for a second, my assistant needs to go attend to some things. That's my Yorkshire Terrier, Roxy. Her place is always on my desk between me and the computer. Okay. The point is that if you think about a patient brought in to the emergency room, unconscious, where's the doctor going to start? How is he or she going to know how to help this patient when they literally have no clue about this patient? Maybe it's diabetes coma. Maybe it's an epileptic seizure that did not complete. There are so many reasons why somebody could be unconscious and not physically injured, right? Okay. We provide that information. And now with electronic health records and what we call interoperability, which means computer systems can talk to other computer systems, and health information exchanges, which you'll learn about in your computers and healthcare course, this information is now available, so the physician can go to the computer and look up the patient's name and see, oh, the patient is a diabetic. Let's check the insulin level. Now, not only does this save incredible time, but it saves incredible money, because this way the physician doesn't have to order a whole battery of tests to give him or her a clue as to why this patient is unconscious. So I want you to know right now, and this is not my opinion, this is the industry, we in the medical records department, in the health information management department, are part of the healthcare team with the physicians and the nurses and all the other clinicians, the radiologists and the pathologists. We're there. And we have a very integral part because we collect all of the information. We are the ones that have control over that radiology report, that pathology, those pathology test results, as well as the physician's physical examination and observations from the last time the patient was seen. This is critically important. Okay, so because we are in charge of such important things and we are a member of the healthcare team, we are responsible to comply with many federal and state laws. And this is the part where we keep you out of jail and prison, because you're going to do an honest, good, never do fraud attitude. Okay. And I also want to engage you in taking it a step further and say, if you see fraud, if you encounter fraud, I want you to help stamp out that fraud. So in other words, when you graduate and you go out on your first job or your second job or your third job, okay, and somebody says to me, oh, do this, and your brain cells light up because you remember that you learned in this program that that is not the right way to do it. I want you to speak up. I want you to, because I have a very positive attitude about people. And my attitude is that if somebody's telling you to do something wrong, maybe they don't know it's wrong. Maybe somebody wrong taught them. Maybe this came, down the generations of employees in this office, and that old, oh, somebody told me that this is the way you do it. Well, in this program here at CCTC, you are learning the right way to do it. So if you find something contradictory, you can step in and educate that person who is telling you to do something wrong, because we're going to go with the fact that they didn't know it was wrong. And we can help you cite your source. We can back you up with the facts, okay? So it's not opinion versus opinion. That's facts. Okay, let's go on. We also need to protect ethical situations, and that's exactly what I'm talking about, or part of what I'm talking about when I discuss fraud. Fraud is the official legal term, okay? But sometimes it comes from somebody really wanting to do something good, okay? So in other words, well, we know the insurance company won't pay for this procedure, and this patient really needs this procedure, and the patient can't afford to pay for the procedure. So we're gonna cheat a little bit, and we're gonna say this is why they need the procedure, not that, because that's not covered, but this is covered. And that way, the insurance company will pay for the procedure, and the patient will be better and everybody will be happy, right? No, because that's fraud upon the insurance company. Okay. And the next time you pay your insurance company premium, you'll know why we don't want to cheat the insurance company, because they don't take the loss. They just pass it along to all their beneficiaries. Okay. So sometimes it's a clear-cut legal issue. Sometimes it's an ethical issue. Okay. Now, because this is college and I want you to feel all grown up and everything, we have two specific terms for the different ways that you can evaluate something, okay, with regard to whether it's an ethical action or an ethical decision or not. And that's teleological, comes from the Greek, okay, and deontological. So teleological, also known as consequentialism, is the end justifies the means. Yes, we're going to lie about the diagnosis so the patient can get the procedure that the patient legitimately needs, and it's not our fault the insurance company won't cover it for that. But we're doing good for the patient. Right. I don't know about that. Isn't there a legal way to help the patient? Could be, right? Instead of lying and cheating and possibly being fined, penalized, and sent to jail. Okay. Yeah, I mean, you could offer the patient a payment plan. You could suggest that the doctor give the patient a discount. I mean, there are lots of different ways. There are charitable organizations like the American Heart Association, the American Cancer Association, that have funds available to pay for procedures. The problem is if the original diagnosis doesn't match with the procedure, what the insurance company will pay for is known as the standard of care. And that's the accepted in all of healthcare industry, actually around the world. But the standard of care is everybody agreeing when the patient has this, you do this. Okay. Now, you may have, when the patient has this, you can do this, this, or this. That's possible. But there are rules, there are measures, there are what is known as medical necessity for doing a procedure. And this is an important factor in what we do, because we don't want physicians performing procedures on patients who don't need it. I mean, would you want the dentist to pull out one of your very healthy teeth just so they could get the insurance to pay them for it? There was a case in California where a physician was doing colonoscopies on patients that did not need it, just so he could get the $2,000 a piece. Okay. Sadly, there are unethical people. There are people who are bad, which is why you had to take anatomy and physiology and understand diagnosis codes, and not only the diagnosis, but the signs and the symptoms. So you can be the backup for the physician and say, you know what? A plus B does not equal C. This is important. And the other important thing is that you may be involved in filing the claim form. And the claim form is the legal linchpin of fraud. Because it doesn't matter what the doctor told you in the office, or the nurse told you in the office, or the manager told you in the office. What matters is, excuse me, what matters is what you did. Okay. Oh, like spilling your coffee on the desk. Okay. What matters is what you did. You are the one filing the claim. Therefore, you are the one that is committing fraud. And I don't know what television shows you watch. I watch Law and Order, all of them, plus FBI International. I love those, right? Ever since I was a little kid watching Perry Mason with my dad. All right. So here's how that works. All right. Imagine you're standing in front of a judge in a courtroom and you say, Your Honor, that I just did what the doctor told me to do. Now the doctor is standing in front of the judge and the doctor said, Your Honor, I don't know anything about medical coding and billing. That's why I hired him or her. They're the ones with the certificate. They're the ones with the certification. They know what they're supposed to do. Now, who do you think the judge is going to fault? As a matter of fact, when you learn about the False Claims Act, a law that officially makes it illegal to file that claim with misinformation, the law actually states if a person knows or should know that any of the information is false, you're guilty. No wiggle room. So isn't that cool? You got to save yourself by standing up for what's right. All right. So deontological instead says, if we can try, we must try no matter the outcome. And this most often will come with experimental procedures, which, by the way, insurance companies never pay for, except in clinical trials, which is a whole separate animal. Okay. But I don't know if I mentioned it later on, but you should find in your course room, either the week 1 or the week 2, a link to a movie on YouTube. It's free. It's called Baby Girl Scott. It stars Jonathan Lithgow and Mary Beth. Oh, I forgot. Okay, it was created as a Lifetime movie. Baby Girl Scott is a movie about a baby born prematurely and everything that the parents and the hospital go through with the neonatologist. And it is an excellent example of understanding teleological and deontological ethical perspectives. The parents want to let nature take its course. The neonatologist has a deontological attitude about doing surgery on this preemie. They even go to the ethics committee in the hospital. It's an hour and a half, 90 minutes. It's well done. Mary Beth Hurt. Okay, see? Okay. Jonathan Lithgow and Mary Beth Hurt is really well done, and it can really drive home these concepts for you and help you think how to approach ethical decisions and how to share that knowledge with other people, because you have to pass along the knowledge. Not everybody knows what you know. And chances are very good, unless you go work in a hospital where you're working in the HIM department with a bunch of other coders, if you go to work in a physician's office or a specialty office or a clinic, no one else knows what you know. They just don't. They barely understand. Now they don't even understand what we do. Okay. My point is that you must not assume, oh, well, the doctor is telling me. You know what? They don't learn coding in medical school. Some of them like to think that they know about coding. Most of the time, they really don't. They don't know anything about the guidelines in the front of your code book. They don't know anything about sequencing. They don't know stuff, but you do, because you learned it right here. Okay. And you can always email me. You can email Ms. Johnson even after you graduate and say, I have this situation at work. Can you help me? And we'll help you. because we're your teachers for life. Okay. All right. So there are 4 elements or principles of ethical decision making, and this has to come with autonomy, which is self-governing. Now, every patient has the right to say no to a medical procedure. This is actually written in the United States Constitution, the First Amendment. Not about free speech. It's about the freedom to say, no, I don't want that. Okay. Sometimes it might be a person's religion that says we don't believe in medical care or we don't believe in blood transfusions. Sometimes the patient just says, I don't want that. Or the patient says, yes, I want that, which is why you will learn at some point about informed consent, which is required for the patient to make a proper and knowledgeable decision. Yes, I want that. No, I don't want that. Okay. Non-malfeasance. Now, you may know malfeasance is doing harm. So non-malfeasance is a principle of ethical decision-making, is we must make certain that this decision does not harm anyone. It doesn't harm the patient. It doesn't harm the hospital, the physician, the practice. And you know what? The insurance company needs to be included in this. Beneficence. Benefit. I always have a problem pronouncing this word. I have no idea why. Okay, beneficence is doing good. Okay. So not only do we not want to do any harm, we want to make sure we're benefiting. We're benefiting this patient. We're benefiting this practice or this hospital. We are benefiting society. That's important. And justice is, sometimes we don't have too much of this as we should, and especially in healthcare. But we have to take that step forward. We have to stand up for what this country is really about, and that is to treat everyone fairly. And remember, in healthcare, we do not see gender, we do not see age, we do not see race, we do not see creed, we do not see anything. It's a human being. We have knowledge to help them. That's your job. No ifs, ands, or buts. Oh yeah, we don't see wallets either. No money. Money is actually, it's against the law for you as a medical coder and biller to take the reimbursement amount between 2 codes into consideration before you decide which one you're going to report. That is against the law. Okay. All right. So there are many decision-making models with regard to ethical decisions. And this is a good thing for you to know, because you may say, I've never been in a situation where I had to make a decision like this. Okay, but you got a whole career ahead of you. And chances are, if you think about it, you may have been in a situation where somebody was trying to elbow you into doing something that was unethical. And people who behave unethically have lots of excuses about why it's okay to be unethical. All right. We don't want to travel that path. So this is kind of a handy thing. 4 steps is you state the dilemma. And, you know, this is a decision-making method that not only has to be about ethics and work. Okay. This can be how you make a decision with your family of 8 people of where to go to dinner. State the dilemma. Harvey had Chinese food for lunch. Uncle Albert is allergic to tomatoes, so we can't go Italian. Okay, you understand what I'm saying. All right. It's important that you learn how to critically think through these things, because you will have need for it somewhere in your future. I say this very sadly. Okay. All right. Now let's talk about where you can work when you graduate. I mean, I'm thinking you already know about hospitals and physicians' offices, okay? But as you're getting closer to graduation, and every day is one step closer, right? I want you to be thinking about all the possible ways where all the possible places, and this is your week 2 reading, about where coders can work. And when you look around, there are so many, so many places you can work. That's not a hospital and not a doctor's office. Okay. Ambulatory surgical centers, billing companies. Oh, Miss Johnson. Ms. Johnson, I am talking to HIM115 right now in our live chat. May I call you later? Thank you. Okay. All right. So billing companies, there are companies that are the outsource for a lot of doctors' offices that don't want to hire coders. Walk-in clinics, urgent care centers, third-party payers. You could go work for the insurance company. Or go work for CMS, the Centers for Medicare and Medicaid Services, the VA, the CDC. They're always looking for qualified coders. And, you know, if you have a background in the military, the VA will give you favored status. I've had many students go to work for the VA. It's great. Okay. Educational institutions like here, you could be me. No, you can't be me, but you could be you teaching. Okay. Attorneys, accident and injury attorneys. Yes, that they have to go through patient records and look for documentation that identifies an error for a malpractice suit, or to identify clearly what the patient's injuries were and how they were treated. You know that because you went through anatomy, physiology, and medical terminology and billing and coding. You understand what the codes mean. Okay. Short-term and long-term healthcare facilities, including skilled nursing facilities. Okay. So yes, you absolutely can find lots of different ways, lots of different jobs. And there is a big need for certified coders out there. So once you finish this program, you sit for your certification exam, you'll have your certification, and then you might get to choose where you want to work. I love that. So to help you understand, because billing and coding, as you can see, coding and revenue cycle is one aspect of health information management. And there's also informatics, data analytics, and information governance. And so there are a lot of different places that you can go in your career. Okay. Now, coding, there are people who code their entire careers, 20, 30 years. They love it. They do a great job. And why not? There are other people who may want to use it as a launching pad to get more into revenue cycle management, to get more into data analytics. It's all about you and how your brain works, but there are lots and lots of opportunities. So I want you to look at this website, and no, you don't have to be a member of a HIMA to access this. www.AHIMA stands for the American Health Information Management Association.org/career map. And here's what you're going to see. You're going to see this map, and you see all those dots. First of all, you see that it's divided into the 4 pathways. Okay. All of those dots are different job descriptions. Okay. And the concentric circles closest in the center is entry-level jobs. Then you have mid-level, advanced, and then masters. Okay. You click on those dots and up will come a dialog box that will tell you the title, the job description, exactly what it includes, generalized average pay rates, and things like that. And again, having this knowledge in coding is a career in and of itself, and or a launching pad to get into other aspects that your brain may like. Okay, so fantastic. And there is great need everywhere. The Bureau of Labor Statistics still puts us, health information management, the whole careers, as growing faster than average, and it has been for quite some time. All right, so every week you'll have at least one chapter assigned. Now, because this is a 10-week class, because it's summer, you may have more than one chapter to read in a week. It's okay, you can handle it. You know, just take your iPad to the beach with you, but make sure you put it in a waterproof thing. Okay, because you never know. All right. But the fact is that you really need to actually read it because it has good information in it. You'll see. Weeks 1 and 2, because week 1 started last Wednesday and ended yesterday. We are today officially in week 2, so I covered everything. Okay. You have 3 chapters to go through. This textbook is a little bit more clinical than it is HIM. So that's why I went through all that stuff about working in healthcare for you all. But it's all good information. I promise you, promise you, promise you. Okay, then you're going to take a quiz. Yay, because we have to measure how much you're learning. And that's very important. Okay, additional stuff. As I explained to you, I believe you should be able to see a link to Baby Girl Scott, available on YouTube for free. Really, really, really good movie about healthcare ethics. It was created in like 1988 or 89. So some things have changed, but the whole ethical aspect has not. Okay. And each week there will be additional stuff. It might be a handout, it might be a link. And as always, you have me 7 days a week. How exciting is that? Not 24 hours a day, but yes, 7 days a week. Okay, also included in week 1, 6 steps to ethical decision making and the AAPC code of ethics for you to ponder. And yes, there are always questions on the code of ethics, at least 1 or 2 questions on the certification exam. Okay. So the best way to contact me is email. As I said, I am in the course every day, 7 days a week. I will answer you within 24 hours. You can ask me questions. I will email you back. Sometimes if it's a content question, it's a good way because then you can print that out and have that for future research. Okay. Sometimes you're not sure exactly what to ask. In that case, we can make an appointment to speak on the phone, or we can do a one-on-one Zoom. We can do FaceTime. We could do Skype. We could do WhatsApp. Okay. Whatever is comfortable for you. Just know I'm here. Okay. Any questions? All righty then. Thank you so much for coming today. I really appreciate it. And I will be posting this recording in the course, so you have it for reference in the future in case I said something that just you want to hear again. All right. And thanks very much. Have a great day. Have a great week. I'll see you next Tuesday.
Bye.
Bye.